This is really meant to just be a device to enhance the overall clinician's expertise and knowledge. So, so many times I think, seeing it as a patient and then also now, meeting other clinicians, oftentimes a lot of modalities are kind of, you have to use it this way. I want to treat a shoulder, this is the protocol, do boom, boom, boom.
Yeah.
And, you're doing that across the board.
Welcome to the Dr. J.J. Thomas Podcast.
Hey everybody, welcome to the Dr. J.J. Thomas Podcast. I'm J.J. Thomas. Today we have Kevin with us. We had Kevin on the last episode, but Kevin is our superstar Winback rep. So we have the Winback machine here. Kevin, thanks for coming.
Thank you for having me.
It's Kevin Sheehan.
Yes.
Okay.
That's all right. Kevin Winback.
I know. I told you guys in the last episode, he's in my phone as Kevin Winback, and I knew it was a good Irish last name, but I couldn't remember right away. Anyway, Kevin is our Winback rep. And that does not, I'm sure you have a different role, like title through Winback.
A couple, yeah.
Yeah, because he's everywhere. I'm like, Kevin is like, where's Waldo? Like, I'm like, Kevin. He's like, I'm in, another country or whatever. So, do you want to talk about your title at Winback?
Yeah, absolutely. So, I was actually employee number 1 here in the U.S. So my boss, Matthew, reached out to my old therapist, actually. So I was introduced to all the technology first as a patient years ago after Winback got their approval here in the States. Was treated at Johns Hopkins for a couple of surgeries. And, when I went in there, this was something I had never seen before. And I was kind of curious and picked my therapist's brain there. And he said, it's a new piece of technology out of France that we're the first place here in the U.S. to have it. I was actually one of the first patients, I think, too, in the U.S. to be treated with it.
Can I give them a little more background on you? Kevin played D1 lacrosse at University of Delaware, total stud athlete, and the brains behind it. So like that, I just have to give them a little background that, when I've worked with a lot of reps in different companies and different machines and devices and whatever, and Kevin is so knowledgeable, like, not like a typical rep. I mean, I think, between experiential learning through your own PT, and then, as you said, being day one with the company, I think you've learned so much, and you teach me so much still. Like, he was just showing me other things that I'm like, this is going to be fun. So anyway.
Yeah, no, thank you. So, I really was curious because this was one of the things I ended up there about 2 years into my rehab journey and a year after my major surgery, and wasn't getting a lot of results with other things, and I started to feel a lot better with this. And obviously, it's a combination of being in the hands of a skilled clinician, which is at Winback something we really take pride in, is working with those clinicians. And just started to feel better, and I really kind of dove into this, and all the free time that I had, I started to research what it was. And flash forward a couple years, my boss went to open a U.S. office and started with the company. A few different roles, but so I covered the East Coast, worked with clinicians like JJ from Maine all the way down to Maryland, and then I'm also the national director of our sports segment. So I work with all of our professional and collegiate teams who are using the equipment. So for me, that's kind of in my wheelhouse, being in an athletic training room and talking to athletic trainers. So it really is neat. No day is the same with this job, and it's really cool because we'll talk about it in a little bit, but Winback has really done a great job of making the device fit into your clinical expertise and not the other way around. So, every time I meet with a clinician, the conversation is always different. How they're using it is always different, but
And I will say that now, like right off the bat, my experience with Winback, one of the reasons, so I should give my experience of how I got introduced to Winback.
Yeah.
So I tore my ACL a little over 2 years ago now, and my friend Doug Adams, who owns Run DNA and Omega Project PT, and he's an amazing clinician also. When I tore my ACL, Eric was my only PT working here at the time. I didn't have the rest of the team yet, and Eric was out of town, and I was a week before surgery, and I was like, I want to make sure I have the best range of motion going into surgery. So I called Doug, and I'm like, Doug, can I come down to your place in Delaware and get a little bit of treatment, try to get my range as good as possible before surgery? He said, absolutely. So I show up, and he puts this thing on me, and I felt so much better. I had 2 sessions. It only took 2 sessions with Doug where I was like, I need to buy one of these for myself and my clinic. And then next thing you know, that was how I met you and Matthew. But since then, even more than that, like besides the fact that you guys have such a strong education piece, so they have Winback Academy for clinicians, which has protocols on there and education and training. As I said, their reps are very knowledgeable, but in addition, they're constantly upgrading. Like it seems like every time I talk to you almost, they're working on another update for another they're good pieces. Like the minute I might think, oh, we'd benefit from such and such addition, they have it. It's almost done. It's in the works. So it's just a company that obviously cares about quality and cares about giving the best care to their patients. So that's been really, really good from my end.
Yeah, I mean, so when I started with the company, early on, you're kind of learning the ins and outs. And for us, we're a global company based out of France. We have, headquarters all throughout the world, and the one here in the United States is up in New York. And I'm kind of learning the company culture, and the first thing that really stuck out is this is really meant to just be a device to enhance the overall clinician's expertise and knowledge. So. Yeah. So many times I think, seeing it as a patient, and then also now, meeting other clinicians, oftentimes a lot of modalities are kind of, you have to use it this way. I want to treat a shoulder, this is the protocol, do boom, boom, boom.
Yeah.
And, you're doing that across the board. With Winback, they really took a kind of opposite approach where the first thing in mind was the clinician, and then the technology kind of followed suit. So Chris, who created the device years ago over in France, really was asking a lot of clinical users who were using other TECAR devices, what were some things that they wish they could do. And, some of the big ones that came up were, combining this with manual therapy, combining it with functional movement and rehabilitation, and also just, looking for ways to take what they're already doing with their patients and supplement this into it. So that's kind of the big thing with us, is we always say, right, Winback is really just, we're trying to add another tool in your tool belt for clinical treatments. We're not trying to tell you how to treat people, right. And we're not trying to change what you do, right, because there's only one of you here, right? And people are coming here to see you, not for a machine. Yeah. But
that is how I would describe it, more like an enhancement. Like I've described it to other clinicians, kind of like the Mario mushroom thing. It's like it kind of powers you up. So, like you said, we just did an evaluation on Kevin. We picked some areas that I thought were important to treat. I did some Winback work, and 5 to 7 minutes of a little Winback work with the massage that I was already doing, and his movement was almost completely clean, even without any needling. So it really does enhance. It's cool.
Yeah, so I think too, one of the unique things, and when I started with the company, it's one of the things was like with the name Winback. I'm not really sure where that comes from. It's not a French name. Yeah. And it's funny, so Chris, who started the company, was actually coming to the US for something and was reading, I think it was the New York Times, one of those newspapers, and the head article on the sports page was about a championship runner who had lost, his champion status due to an injury, came back and won back.
Are you kidding me?
Won back, his championship title, if you will. So he was like, oh, that's a great name, Winback. And so the whole premise around the company, right, is that we, every patient that comes in here is trying to get back to some portion of their life, whether it's, athletes returning to sport, whether it's, people living pain-free so they can play with their kids or whatever it may be.
Or their dog.
Or their dog. So for the company, that's where we kind of took that and really embraced that name, because we want to help, people win back their lives, their well-being.
That is awesome.
Get back to what they want
I
to do.
can't believe that's the first time I'm hearing that story. But it's funny because I've had patients say to me, like, we'll use the Winback on you. And they've heard Winback, and like when they hadn't been exposed to it yet, and thought that I was saying, it was probably after needling, like, I'm going to win you back. Yeah. Like, I'm going to win them back. So I'll be happy to tell them that is maybe the second meaning. That's
Absolutely.
Cool. What about, let's talk about TECAR Therapy a little bit.
Yeah, so TECAR Therapy, it's funny because it's a pretty new modality here in the United States, but it's actually been around for over 100 years. So the concept of using, a radio frequency to stimulate healing in the body has been around since the late 1800s. And, as most things in Europe, they kind of started to play with different frequency ranges. And, into the mid-90s and late 90s, they kind of formed that a range of 1.3 megahertz to around 200 or 300 kilohertz, depending on who you ask, is going to increase the permeability of the cell. So we're able to really flush toxins out, get nutrients back into the cell, and kind of restore the body's cellular ability to heal itself. And as you know, right, that's kind of the building blocks and the foundation of healing. So for us, we kind of took that idea and really wanted to, again, make a device that covered that whole frequency range, but two, also allowed you to facilitate that process right at the dermis and epidermis, all the way down into bones, tendons, and joints. Because whether it's, we're managing scar tissue from a knee replacement 10 years ago, or we're looking at someone who's about to have, total knee replacement, and we want to try to get them the best that they can going into it.
Or just had it.
Or just had it, yeah.
Yeah.
So really the cool thing with this is, I tell everyone it's not a sales pitch, but 9 out of 10 people are candidates for this because of the wide range of conditions you can treat.
And that's what I was just going to say. Like Winback really did. I think what they did was they took that foundational knowledge of TECAR of electrical current and what it can do at high frequencies for the body on a cellular level. And then, like you said, they had the clinicians in mind. It's very obvious through the basically through the features that it has, is what I want to say, because it can be used. You can change not just the type of frequency, but also the material that we use. And we're going to show you this through a demo with Shannon in a little bit, you guys. The material that you're conducting the frequency with will change the depth, right?
Yep.
But they've also made the intensity changeable so that we can use it and have a low thermal effect for those that are like post-operative, and we still want the cellular changes, but we don't want to like overheat or overstress the tissue from a metabolic standpoint. Or we can, if we have old scar tissue or old chronic condition where we really want to heat the tissue and get more blood flow and get more neovascularization, then we can do that too. So
exactly, yeah. That's the big thing with us too when designing the device and kind of educating everyone on it is, right, I mean, there's never going to be something that does everything perfectly, but when you're looking at other modalities, especially clinicians who might be looking to bring in their first piece of technology, for us, we wanted something again that's going to touch a lot of your bases and to provide a really comfortable patient experience. And I'm sure you can speak to this.
Yeah.
This is your shock waves and other things. They do great outcomes and get great results for your patients, but they can be uncomfortable at times, or I say they hurt so good, because you're eliciting a different response in the body. With this, our kind of tagline is better, faster, gentler, because it really is that comfortable, gentle patient experience.
Yeah, it really is. Should we show them?
Absolutely.
All right, Shannon, you want to come over? All right, so Kevin, why don't you come around with me? We're going to actually put Shannon on the table.
Perfect.
And then we're not going to do a movement testing or anything.
Like
I'm literally just going to show
class.
them the features. Yes, it is like a cooking class. Come on over, Shannon. You're going to lie on your back. And I'm going to do everything from this side. That's okay, right? You can see? All right, so because it's electrical current, you guys, we need a ground of some sort. And so for clinicians that are already using Winback, this may help you. I know when I was first starting to use Winback, a lot of times I was calling Kevin like just with some of the basic principles. And essentially the handpiece current is going to go to the ground for the most part. So that's something to remember. It's going to take the most direct path that it can. So that's something to remember when you're deciding what tissue you want to treat. For instance, if I want to treat, let's say I want to treat Shannon had a quad strain that I want to really work on, then that's going to change what all kinds of different things. It's going to change. The head that I use might change. The intensity that I use might change. Where I put the ground plate might change. Let me just get a towel to support.
What are you treating?
So I'm gonna literally show like all different things, probably on the quad, but I might go down to here as well.
Okay.
I was thinking mostly leg because it's easier to.
Easy to see.
Yeah.
Everything in one spot.
I could at some point flip her if it's easier, so I can be on that side, but then I have to move all that.
Yeah.
Okay. So relax, Sean. So we good? So I just took a towel just to make sure the ground plate's in good contact because, as I said, like the electrical current's going to transfer from the head to the ground contact plate, and if the contact plate has less surface area than the head, then that may confuse where the current's going.
Correct.
Essentially, right? So if I want to treat like a quad strain on Shannon, I'm going to definitely choose the head with the cover on it, because the head with the cover on it is going to it's called the capacitative head.
Yep.
But because it has a cover on it, essentially it resists some of the electrical current going through, which makes it hit more of a surface area than if I do the metal head, which looks like this.
Yeah. So yeah, absolutely. Yeah. So the devices we're using, like I said, kind of a frequency of our spectrum of frequencies. So we're using 1 megahertz setting, 500 and 300. With the capacitive, we're going to be using a 500 or 300 kilohertz frequency range. But what's nice is there is, a ceramic coating to that applicator, so it's going to keep the metabolic action relatively superficial, so about 2 to 5 centimeters to affect changes in tissue with more water content. So again, with like JJ said, if we're coming back to muscle strains, this is really where we want to keep it relatively local to that muscle.
Okay, yeah. So if we want to work on on superficial and like soft tissue that's going to have more water content, then the covered head is going to be the way to go. We have 2 units here because I said they're the best company on earth. I'm sure I'm not being salesy, but we have the back 4, which has 2 handpiece options plus the ground plate. The back 3 has the 1. Yeah. So when I'm using the back 3, I don't always have the option to do both, but I can also use the metal head here, which is going to get me the deeper tissues, targeting more resistive tissues like bone, maybe scarred down areas, maybe a scarred down or entrapped nerve area. So if this is a chronic injury for sure, then we can hit all the areas at once with the ground plate underneath.
Yeah.
Yeah.
And so coming to that point, so TECAR Therapy is an acronym. It stands for the transfer of energy, capacitive, which is the black head, and resistive, which is the silver head. Our company had a little fun with this tagline, but most devices out there are really tech or with an O because you're only using capacitive or resistive. So with the back 4, we're kind of the first TECAR device out there because by having the 2 channels, and as JJ's showing, you can really use the capacitive and the resistive at the same time. So the clinical benefit is, we're able to target both pathologies, superficial and deep, simultaneously. So especially if we're trying to maximize our time, it allows us to, take what would be maybe a 10-minute treatment, and now I can condense it down to 5, and it frees me up to now do some other things, right?
Exactly. And we'll talk about this later, but you and I were talking about some of the mobile options. Yes. I want to show that in a little bit. But for this scenario, what I was hoping to do is kind of paint a picture for clinicians out there who want to know scenarios where they may use the Winback, or ones who already have the Winback, ways they can utilize it. So because I know that was one of the learning curves I had in the beginning. So for instance, let's say if Shannon was an acute injury, like an acute pull, we may not want to get a whole ton of heat in that. I'm talking a day, within the first 3 days of injury, of a not even a pull, more of a tear, then we wouldn't necessarily want to get a high thermal effect. We really just want to flush out the inflammation, support the cellular healing and reproduction of that muscle tissue. So in that case, we would keep this, the CET and the RET down to a pretty low, 10 or 20%. The reason I wanted to highlight this in particular is because, in case you hadn't noticed, I'm kind of for the most part, I'm a recovering all or nothing kind of girl. And I think when I first had Winback, I had a hard time recognizing the value of the low percentages. Yeah. It took me a long time to be okay, it's not that more is always better. Exactly. It's that it's really we want to match the right scenario to the right scenario. Yep. Right?
Exactly. And so we see this a lot, especially in the sports med side of the things that we work with. You're seeing those inflamed ankle sprains, things like that, where we want to let the body handle that inflammatory process and not draw more fluid to the area, which of course, the heat with this device is all endogenous. So, if you're getting an increased heating sensation, that means we're pulling more cellular metabolic activity and oftentimes more blood flow to that tissue. So to help with those early on stages and really decreasing the inflammation, it's really great. And it also comes back to, especially when we're thinking about more resistive tissue, if it was an ankle sprain, for instance, I could work locally and I would put that grounding plate all the way on Shannon's back because now I'm sending fluid all the way out of the leg since it's traveling from the foot to the back. So you can see really, really early on the decreases in inflammation, which is going to allow you to get into your ranges of motion and some strengthening a lot faster. So that's why when we see typically a 2 times faster recovery rate for most musculoskeletal conditions, that's why, is because we're able to start and get on top of things right away.
So on that note, if we talk about an ankle sprain, and we're talking about swelling, there's also the lymphatic piece to this, which is so cool. And that's mostly the Bach 4 has that, right? I don't think the 3 has that. And so there's actually a drain protocol on the Bach 4 that we use not just for things like ankle sprains and post-op knee stuff, but even a lot of pelvic floor issues, women postpartum, women really chronic postpartum even, who still just have that difficulty getting that kind of lymphatic flow going. Right. Absolutely. That's been one of our favorite features of the Bach 4.
Yeah, no, it's great. I mean, it's kind of funny every time. I feel like JJ said earlier, when you start to see new people, the company is always kind of forward thinking and just conditions and ways to improve some of those outcomes. So when this first came out, the drainage function wasn't on there, and then they started to really think about ways to play on the lymphatic system and decrease that that inflammation. So they came out with those protocols, and
Yeah, it's been awesome. So so good. So that's like the low 10%. If we had a chronic condition and we really wanted to heat that tissue, let's say a different scenario is somebody who had, a knee injury or maybe an arthritic knee, and they had an injury or even a knee replacement like 8 years ago, and they just never got their range of motion back, and now it's manifesting into back pain or hip pain, or they're getting other injuries because this knee is just really restricting them. Then I might crank that baby up to like 40 or 50, depending on the person. Remember, every person, depending on their adipose tissue and muscle tissue and whatever, is gonna tolerate the percentages differently. So you do still have to get feedback from them, but closer to a 40 to 50, maybe even higher if they can tolerate a percentage.
Absolutely.
Right? And I will say, I think actually we should pause and let's show it in sitting so we can do some like movement with it, because I think this is kind of cool. So just sit off the edge, Shan. Yeah, so the other option you can do, like Kevin said, like you can still be your creative self as a therapist and combine goals, I would say, to make your treatment most effective. So we have the ground plate under Shannon's thigh. And so Shannon was that scenario where she's got old chronic stuff. We have this cranked up to like 40 or 50. We have the capacitative and the resistive, so we're gonna get some more superficial tissue, but we're also gonna get the deeper tissue. And then if we can decide to have the joint open here and work at the joint a little bit, but we can also, if we wanna say focus on the quad more, I can have her do some knee extension with this. So now we get motion, and now that does also change the resistance of the tissue, right?
Yeah.
So it will change the way, from what I understand, Kevin, tell me if I'm right or not, but when you now increase muscle activation under the heads of the hand pieces, you're gonna get a little bit of change in resistance. So essentially the muscle tissue is a little denser at this point, right? So we can prioritize a little bit more muscle work here.
Yeah, and the nice thing too is, coming back to that. So TECAR Therapy is drawn towards resistance in the body. So if you have really healthy tissue, it's going to conduct pretty efficiently. So your thermal sensations aren't going to be as high because everything's able to move to and from through that tissue pretty easily. When you increase the resistance, whether it be scar tissue, damaged tissue, or in this case, right now we're kind of mechanically creating it with that muscle contraction, we're able to also now isolate and target the current more specifically into the parts of the muscle we're activating. And so we'll get to it in a little bit too, but around that concept, right, some of the innovation with the company was for the people that have a hard time activating or even loading, we also built in that muscle stim feature to be able to stimulate too.
Yeah, I was actually just heading there, so you're reading my mind. Yeah, so one of the added things that they've had since I've been using it, I think, is the addition of now essentially electrical stimulation. Well, essentially you're pulsing the 300 and 500 hertz.
Correct.
In a way that the nerve fibers will stimulate muscle contraction as well, right?
Yes.
So it's basically interrupting the pulse.
Yep.
So that it targets the muscle fibers, yes?
Yes, so we have two settings. The high tens is going to take that radio frequency and it's just going to pulsate it to mimic the effects of a tens unit on the nerve. So, for those people that are really into the science, if we're looking at the waveform, it's not going to look like that of a tens unit. It's still going to be the TECAR wave, which is a sinusoidal radio wave. However, we're just sending it in bursts independently.
Try to relax.
To be able to kind of play on nerve pain. The other thing we have is the EMS, which is also on its own signal. So the cool thing is right, we can run that and the RET at the same time. So as I'm contracting the muscle, I'm also healing it with that deep heating sensation. But that is just going to be a 1500 or a 4000 hertz electrical signal. So it's just going to be there to really pump and recruit the muscle.
But what do you have it on right now?
10%.
So so he has it on the radial. So this is the other thing. There's more option. But wait, there's more. So he has it on the radial option. So radial, I think it just, essentially the way I view radial is it's a little bit more superficial. It's going to be it doesn't quite penetrate quite as deep. And so if I really want that muscle to contract, then I like the focal one. And then let's let it contract a little. Let's give her a little bit more with that.
Yep.
So I could continue to do this with it too, honestly, but I just really want to see that muscle. There it is. So you can start to see her quad contract now. And then Shannon, let's do some. So again, now we have post-op total knee, post-op ACL, post-op meniscectomy. Let's have you extend your knee with this. Great. And then come down. So we're getting mobility with it. We're getting muscle activation with it, with lots of, one of my things, keep going up and down. One of my things with other therapists is like, I have these like principles, right? And essentially one of them is like, everything we do is input output. Whether I'm needling you, whether I'm saying hello when you walk in the door, whether I have TECAR on you, everything's input output. And so the TECAR machine is allowing me to have so many different inputs to the nervous system.
Absolutely.
Yeah. Yeah, so hopefully you guys can see that. Go ahead and just relax again one more time, Sean. That looks so good.
Oh,
yeah, baby.
There.
So we just love this. All right, good. Let's see what else. So we have adhesive electrodes on Shannon now, so that it gives us all a little independence, but it also allows her to move better, not being like having to work around me as my hands are all over. So Shannon, so we can turn the unit on. Do we have it on?
Yep.
Yeah, so we can put it at whatever setting we want. Like again, like we talked about, whatever our goals are. If we strictly want more cellular change, then we're going to keep it at a lower level. If we want more of a thermal effect, I'm going to put it at a higher intensity. We have the RET going here. Do we have stim on it? No.
No. Turn it on.
Yeah, let's turn some of the stim on. We'll do so we have the high EMS along with it, and we have it at a 20% right now, which we can play with. So Shannon, go ahead and let's do some knee extension just with that. So again, we're just enhancing, as Kevin said in the beginning of the episode, we're just enhancing the work that we're doing now through a mobile electrode. Mm-hmm. We can also, if she has enough room, move this to like squats. As Kevin said, we could even do it all the way up the chain to the back. Like if swelling is an issue, Shannon, let's lie back. So just put your legs up here and then, scoot all the way back. I'm gonna actually elevate your legs. So we could combine things like concepts that you're already doing in physical therapy, right? If this is a post-op knee, we wanna get a little elevation and we wanna get some ankle pumping. We could do this just like this, or we could do it even with some straight leg raises. Go ahead and lift, right? So now we're getting lots of goals at once. We're getting blood flow, we're getting lymphatic flow, we're getting drainage, we're getting muscle activation. What else are we getting?
Yeah, everything. And then for those of you too that have like recovery rooms or things like that where you're using compression therapy, you can also use this and those compression boots at the same time.
Oh, that's
so you
awesome.
would put this at a low intensity, again, grounding plate in a central spot to move fluid out of the legs.
Yeah.
But then you're also going to get the benefits of the compression moving fluid out as well. So especially, marathon runners, things like that. It's a really great way to kind of supplement their workout plans.
I'm glad you said that, because I love the recovery boots. They're another thing that I purchased when I had my ACL done. When I bought the TECAR, one of the reasons it made sense to me is because it is electrical current, and everything in our body basically responds to electrical current.
Yep.
Like our nervous system responds to electrical current. Our cells depolarize because of electrical depolarization. So to me, we're basically speaking the body's language. Mm-hmm. And so yes, the boots are great because you get an actual mechanical compressive component that flushes fluid. But when you add the electrical current with that, it's like...
Yeah, that's like one of my favorite things when I go in places. People say, how would I explain this to my patient? And I say, right, we're doing something that the body's going to do with time, right? The younger you are, you sprain your ankle, a doctor says, hey, in a week, you'll be okay. You sprain your ankle when you're 50, takes a little bit longer, they put you in a boot. And then you do it when you're 70, you might be looking at surgery, depending on the condition. It's just because your body can't heal itself as quickly. So this is really more or less kind of using, like you said, speaking the body's language, using a current that the body recognizes to help stimulate a healing response in any tissue.
And that's the thing, you're kinder than I am, because I guess maybe because, no, it's true, but because I see patients all the time who their body didn't, like, for whatever reason, they weren't able to heal their body. Mm-hmm. And so it's more than that to me, because it does access tissues that we weren't able to access otherwise.
Yeah.
Yeah.
Absolutely. I mean, again, that's kind of when we created this too, and the idea between a lot of different accessories and reasons why we're showing you different setups is, right, there's only so much that your protocols can do to affect changes in the body, but this is affecting the cellular matrix in addition to all those things. So the goal is for this to again, combine it with what you're already doing.
Speaking of, I was listening before we did this, I was listening to one of the things on the Academy, on Winback Academy online. When you buy a unit, you have access to all this great educational material. And I was listening to one of the lectures on like fascia. Mm-hmm. And I started thinking of people who do a lot of fascial work, like structural integration. So even if you're a massage therapist listening to this who does, especially if you're trained in like anatomy trains, or foundations training,
Yeah.
or your structural integration, or your Ida Rolf trained, all of these people, if you're trying to access fascia, you can have the settings to prioritize accessing the fascia, and then you can do mobile units and you can stretch them with it as well.
Yeah. And that's been a big one for us, and it's funny you say that, because my old therapist, who also does some educational things for us, is, he says in his talk about TECAR is, hyaluronic acid is kind of that foundation, and you want to increase hyaluron in the body, and that fascia, when it gets sticky, it's such a hard thing to manage, with your hands, and there's a lot of great techniques out there, but this is going to help increase the viscosity of it, so you again can now start to get fascia to move easier. Then you add in the manual component to it, and you see a lot of changes right away in a 10-minute session.
All right, so let's move to some deeper stuff, which is like the needling stuff, which is something that some of you may not have seen much of. All right, guys, so we are on with, we want to show you some other ways we can use different tools. Like, again, this Winback is meant to just enhance what you're already doing as a physical therapist. So for those of you that already use tools, instrument-assisted tools, like this one, you can have the ground plate, remote from the area that you want to work on. Remember, it's always going to be a direct line, so the most direct line from where the input is to the output, to the ground plate, essentially. And then I have the bracelet on, so remember, when the bracelet conducts the electricity essentially through my body and then to the metal object that I'm using. So now now that the unit has turned on, we have it on a low, like at 30%, so a little bit more than the, like, we're gonna get a little bit of thermal work here, kind of a subacute phase. And then we can just use a regular instrument assisted tool like this to transfer the energy through the bracelet to and so again, just makes my life a lot easier.
And the benefit here too is, right, when I like to kind of think things like when you were setting inputs and outputs. Another thing is, congestive therapies and decongestive. So, right, with a tool you're applying pressure, so it's more of a congestive, right, because we want to elicit the body to start healing the tissue in that area with the kind of micro trauma from the iastim. With the Winback, we're now kind of getting a decongestive in a way at the same time, because it's just trying to do those cellular exchanges without any response, negative response on the body. So with this in particular, some of those hamstrings, quads, areas that are really, really dense and kind of like a rumble strip as you're going through it, the petechiae can look a little rough the next day. With this, because we're at 30% getting some microcirculation with it at the same time, it'll also help it be a more comfortable treatment for the patient and help with some of those effects afterwards as well.
Yeah, I mean, I just had a course this last weekend, and we were talking about not just the mechanical effects we're having on people, but remember, every input that we give is changing their somatosensory cortex in their brain. So if we have the opportunity to enhance a mechanical effect through something like an instrument-assisted tool by adding electricity to it, we're giving even more signals of input to the somatosensory cortex to help heal that tissue, because ultimately the brain controls everything. So this is a great option if you don't happen to have the adapter to do, so bracelet and this, if you have a Bach 3, essentially, right?
Yeah, works on both. Yep.
Yeah, and then you can also, so like I said, they're always up in their game. So once they saw therapists combining that, they actually developed a tool where it can go directly through. So I don't have to wear the bracelet in this case. The electricity will conduct through their own tools that they created for us. And we can go now, same kind of thing.
Yeah, we're kind of always had the clinician in mind with everything we're creating. So for this, right, let's say, especially female clinicians, right, pregnancy is a contraindication. So wearing the bracelets means, you're a part of the system, so you wouldn't be able to do that if you're pregnant. However, with this, you're not a part of the active circuit. So again, I can still do my scraping, the exact same treatment I was just doing. It's just now, freeing me up from that standpoint as a clinician.
Yeah, and I mean, it's just awesome. Yeah, thank you. So that's sort of the instrument assisted. Now, those of you that are already using instrument assisted, this is, again, kind of like the difference between capacitative and resistive. The instrument assisted tools are going to give us a little bit more of a superficial effect on tissues, which has a lot of benefits. Like we need the entire depths of this beautiful quad to be mobile and I want to say pliable. And so this is a great method for the more superficial tissues. We'll often combine something like this with something like needling, where we can now access deeper tissues. All right, so we're gonna find some areas. I have the ground, always put the ground plate in first when you're getting ready to needle, so they don't like put the needles in and make them move too much. So I'm gonna find some taut areas of tissue that Shannon can benefit. Shannon has an old ACL. When was the ACL surgery you had?
First was 2014 and then 2018. Same knee.
Yeah, so when I don't know if you guys saw, when I was doing work with the instrument, you could see some restrictions right here in this lateral quad. So I'm gonna tease those out and target them with the needles. Gotta get my JLo readers on. And if you are a needling therapist, you wanna use a little bit of a longer needle here so that you're not burying it to the handle. Like Shannon's got great quads. She was a soccer player, and you want to just make sure that you're allowing some of the needle to not be buried to the handle here. So I may need one longer than this, we'll see. So I'm gonna set up so yeah, you see that band right there, a nice taut band. Plenty to go around here. There's another one right there. Compress, spread, tap. And then I'm gonna go essentially right there. I'm on femur there, but wow, that's good. Now I'm gonna let the tissue gather around. I'm gonna set a couple up because I wanna show those of you that use needling with the Winback right now, I wanna show you some different options. There's a couple different things you can do. So we'll set a couple up, and there's another, so right here. I just want to make sure it's in sort of an active trigger point. There's one right there. So now we're good. So we'll just do those two just for the purposes of showing you what we do here. And then, yeah, we're going to take we're going to do an RET setting with the handpiece first. I usually do a little lotion on there. Thank you. Good. And then we'll go to, I'm going to actually, so it's on 30%. I'm going to put this around, I'm going to rub this around. I think I need a little bit more actually. You thought I was going to go directly on. I'm going to do that next. So a little bit more cream, and then we're going to actually go around the tissue here. So just the resistive head, the metal head, and I'm starting just with the RET. We can actually even add the EMS stem on this as well. And if you think about that, we input a metal object in here. So once we add the stem, we can sort of indirectly, you want to do it for me now? Great. So we have the high EMS, it's on the focal. Focal's my favorite. It's on the focal setting, and I think I just messed up my hair. It's on the focal setting, and so it's only at 20%. We could probably go a little higher. Great. And then, so it's essentially conducting now through her muscle tissue and targeting the needles a little bit. Now, if I want, if I touch the handle here, I'm not touching any part of the needle that's going in her, so I can touch that without a glove. And I can actually change this needle a little bit and then get a little bit change in where the current, because these needles, especially these iDry needles, they have a great surgical coating on them around the outside of them. So the stim will actually accumulate on the very tip. So if you're trying to target a different depth of tissue of the muscle, you may have to pull that out a little bit. Let's turn that stim up just 1 more percent. So now 40%. Yeah, and then just see if we can get any muscle. There it is. And so we're getting it through the head, but also a little bit of added effect to those needles that are in there. So I really like that. I'm gonna pause it and show you another option. So now we're gonna show you how to target the needles using the bracelet. So this one, we're not gonna go anywhere near the 30%. We're gonna go much lower, because essentially I'm gonna use the bracelet to conduct the electrical current through my hand, and then I'm gonna touch the needle. Again, so we'll go to like 10% at first. This is RET 10% essentially. So everyone that has heard me talk about finding a good continuing education company for dry needling knows how I am about gloves. And so the way you do this, if you noticed, is I wear the gloves, I put the needles in, I set them up, then I take the gloves off. When I touch this needle, I need the gloves off so that I can conduct the electricity, because the gloves will be a barrier. But I just have to make sure that I'm not touching any part of the needle that will go inside her. And then that's still a safe and clean technique. So we'll go ahead and turn it on now. And essentially the way to do this is you want to approach them with more surface area from your hand at first, and then you're going to, from there, touch the needle to conduct the electricity from your body to theirs. So we'll start with this one. So I'm going to put the side of my hand here, and then I'm going to touch the handle only. And then from there, I can even manipulate the tissue a little bit while I'm in there. You know, I essentially could touch outside of that if I needed more control over it. But really, if I'm not really heavily pistoning the needle. I'm gonna put my glasses back on so I can see better. I'm not heavily pistoning the needle, so I can just do that approach where I just touch whole hand and then put my hand on the needle. Now I'm conducting, and I can change where that current is going from there. Okay? So if you didn't do that, then potentially it would be really an abrupt change for them on the needle. If I just touch this needle, then all that current, even though it's only 10%, would go right into that needle, and it might be a little intense. So that's why we teach this technique where whole hand, touch, and then manipulate if you want. The other option, I showed you the head option. Oh, I should go back to the head because I want to show them the, let's pause this. So we can also do the current through the head touching the needle. Again, this I said I used with someone recently, and she's a runner who has a lot of kind of chronic long-term overuse injury type things. And we used it on her legs, and thank you. And it was excellent at kind of sort of, I said it was almost like an AED, kind of shocking, directly shocking the muscle in a way that helped it recruit better. It like snapped it out of it. So again, when we do this one, I'm gonna put high EMS, focal, but I'm gonna go way down to 10%. And then I can hit play, and then I can directly touch the needle with this if I want. And so that's 10%. Isn't that crazy? So therapists, clinically, clinically, if you're thinking about how I would use this, this is for the patient that you just can't seem to wake up their muscles. And so, like when we teach needling, oftentimes we'll say, when somebody has a hard time recruiting muscle, we'll say one of the ways you can help the muscle relearn how to fire is by mixing it up on them. And so all these different types of input using the electrical current is going to, again, wake up the somatosensory cortex in different ways. So for instance, when we teach dry needling with stim, if their muscle is having a hard time recruiting and firing, we will often, as instructors, coach them to say, okay, play with the frequency. Try it at 3 hertz, try it at 15 hertz, try it at 20 hertz, and then go back and vary it so that the brain doesn't sort of adapt to it. And it's the same thing with this. Like, you can do all these different inputs to actually give more sources of stimulation to the nervous system so that it wakes up. And this is one of my favorites. You just have to go, 10% is really all you need for this one because it's metal to metal, direct. And as I said before, if I want to get a different part of the tissue, I may have to pull these out a little bit because it's essentially going to the very tip of that needle. And then I can touch it and get a different layer. And that one doesn't have much there. That one's pretty good. That one I knew was going to need it because when I was massaging her, you guys probably saw that with the instrument-assisted tool. It was pretty limited. So guys, thanks for joining us. I'm going to take these needles out as for you clinicians that are needling with the Winback. We'll put our gloves back on to get this needle out so that we can compress the area that we needled right afterward using clean needle technique. And then basically, again, I showed you a lot of the features that I like with the Winback and that I've seen really useful with our patients. There are actually more features even than this. So if you have any questions, reach out to me. I'll connect you to Kevin as well. Just let me know. And hopefully if you're local and you want to come try it out, I'm happy to show you how it works. And if you're not local, we'll get in touch. Yeah. All right. Hope you enjoyed it. Let me know if you have any questions, and we'll talk soon.